What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central stir processor? All right, guys, we are looking at the top basic instruments. These are the bread and butter of just about every set you'll ever encounter. So identifying them, knowing how to inspect them, knowing how to test them is critical to the quality of your set and your production. If you can identify these instruments easily just by looking at them, you are pretty much set at being able to do whatever set you come across. But this video isn't about identifying instrumentation. It is about the inspecting and testing of these critical instrumentations in your sets. These are our clamps or our ring forceps, as some like to call them. All right. So, but before we talk about the inspection and testing of these devices, let's talk anatomy. All right, guys. So here is a basic crowd forceps, a peon, whatever you want to call it, goes by several names. But know about the identification is about the inspection and anatomy. So the distal tip, the working end of a clamp, is called the jaw. Okay, where the instrument pivots to the distal tip, that entire area of that instrument is called the jaw. Where the instrument is connected and pivots, okay, is called the box lock. This is the weakest point of the instrument, guys. Extending from the box locks is the shaft down to the ratchet where the instrument clamps, and where your fingers operate the instrument is called the rings. All right, so now that we know the anatomy of our instrument, let's talk inspection. First things first, alignment. Your jaw should align. When you close your instrument, your jaw should be even and they should not be off center as such. Okay, that is a damaged instrument if it off centers like that. Now I'm forcing this one, and you shouldn't be doing that to the instrument, right? Because you can cause damage. But your jaws should be aligned. They should be clean. They should meet all the way down to the box lock. Okay, and now that we're in the box lock, we want to inspect the box locks for any damages. Okay, there are stress cracks that happens at the box locks, especially with instrumentation where you can see how the box lock was constructed. This one uses a pin to place the instrument in place. It's not a wraparound box lock. It is a marriage of two sides and then connected with a pin. Look at the area around that pin for any stress cracks. It is very common to see that in instrumentation after some time. Not all instruments have that pin, so look for that little pin on your instruments and then look at the area around that pin for any stress cracks. Okay, going down is the shaft. The shaft should not be bent. There shouldn't be no abnormal to the shaft, no debris. The ratchet should close completely. You should hear a nice little audible click each time you close that instrument tighter and tighter. Okay, around the ring, check the ring for it. Okay, and what are you checking for? You're looking for stress cracks as well. It's not uncommon to see a ring crack. Very difficult to do, but it happens. All right, now we're inspecting for cleanliness. You want to go back to your distal tip and inspect for cleanliness. Make sure that those serrations are clear, whether they run vertically or horizontally. There shouldn't be excessive damage on those jaws. Now, not all the jaws of the instruments are serrated all the way through. Okay, as you can see with this Alice forceps, it is smooth all the way along the jaw into the distal tip or the working end of the instrument that actually has a jaw. Same thing with this Babcock. This Babcock is used to grasp tubular or circular tissue within the body or organs, so that you don't cause any stress on it. But again, no serrations until you get to the distal tip, and then it has a rounded end with horizontal serrations. Okay, instruments that have an angle on it, make sure that the instrument is meeting correctly at the tip and along the curve. Check the jaws again for cleanliness. The box locks, both sides of it, make sure that there's no debris, no damage. Check the instrument for smoothness. You shouldn't feel no unwanted friction or resistance when you're opening and closing your instrument. It may be needed that you may need to lubricate your instrument, but check your IFUs to see if you're allowed to or the type of lubrication that you may require. You may require like a mineral oil based lubricant or a instrument milk water based lubricant. All right. Next, we want to talk about the ratchet and the ratchet test, okay? Not only do we want to hear a nice click and audible, okay, you want to go on your first click, okay, and we're going to do the ratchet test. Place one thumb and the index finger on the box lock. Keep your instrument on a nice angle, about a 45-degree angle, and tap on a hard surface. Okay, you don't want to tap like you're beating the drums, but you want to tap enough to try to force the instrument to pop open. It should not pop open. Okay, it should maintain in a closed position. That way you know that the ratchet is doing what it's supposed to do, and that's keep the instrument closed to oculate or to clamp on a tissue. Okay, the longer the instrument gets, the more sensitive the tap test becomes. Now, I think there's a limit. I'm not sure all the way, but I'm going to show you an instrument that's about 9 inches long, and I think this is the limit for doing a tap test on an instrument. Anything above 9 inches, doing the ratchet test is extremely difficult, and you can misdiagnose a bad ratchet. All right, some instruments that you do not tap test, okay, these are towel clamps. This is a non-perforating and a perforating towel clamp. As you can see, the ratchet are touching, but the jaw is not. Okay, so the tap test isn't valid for this instrument. It's not going to pop open. It's never going to lose its ratchet ability unless the shaft is bent or the ratchets are completely worn out. But as long as you can clamp this instrument to hold down a drape, which is what they're normally used for, then that ratchet is okay. Okay, this is a perforating towel clamp. Okay, the jaws do meet, but again, it's not designed to be held on a first click. It's used for full closure on the dressing of the patient. Now, not all jaws have teeth, but the ones that do, please make sure that the teeth align and that they're present. Okay, over repairing our instruments or sharpening those teeth can wear them down and it can actually crack. Make sure that the teeth are fully engaged and that they align perfectly. Okay, the same thing with the jaws of the instruments. Okay, make sure that those serrations line up, that they're not bent. And again, make sure that those jaws are in sync with one another. Okay, and not off-centered as I just showed. All right, guys, so these are all the basic instruments. Not all of them, but this is the majority that you'll see in just about every set. And identifying them, being able to test them properly, and inspect them for cleanliness is vital because you're going to see these in every single set. And you should know them like the back of your hand. Okay, so that's it, guys. All right, as always, stay true to yourselves. Keep it 100. Continue educating yourself. Until next time, peace.